Understanding HIV and STIs, a guide to sexual health. Sexual health is a vital aspect of our overall well-being, impacting not just our physical health, but also our emotional and social lives. It's important to be informed and proactive about it. Sexual health is important for overall well-being. It encompasses a range of factors including the prevention and treatment of sexually transmitted infections, or STIs, and HIV. By understanding these conditions, we can take steps to protect ourselves and our partners. This includes understanding sexually transmitted infections, or STIs, and HIV. These infections can have serious health consequences if left untreated, but with the right knowledge and resources, they can be managed effectively. These infections are common, but many people don't know much about them. Misconceptions and stigma often prevent individuals from seeking the information and care they need. It's time to change that narrative. We're here to break down the basics, dispel myths, and empower you to take control of your sexual health. By providing clear and accurate information, we aim to help you make informed decisions. Knowledge is key to prevention and early detection. Understanding how these infections spread, recognizing the symptoms, and knowing when to seek medical advice are crucial steps in maintaining your health. This guide provides essential information about HIV and STIs. We'll cover the basics, including how these infections are transmitted, the symptoms to watch out for, and the best practices for prevention. We'll discuss how they spread, common symptoms, and ways to protect yourself. It's important to remember that early detection and treatment can make a significant difference in outcomes. Remember, accurate information is crucial. Misinformation can lead to unnecessary fear and stigma, which can prevent people from getting the help they need. Stay informed and seek out reliable sources. Always consult with a healthcare professional for personalized advice and treatment. They can provide you with the most accurate information and support tailored to your individual needs. Your health is your most valuable asset, so take charge of it with confidence. What are HIV and STIs? HIV and STIs are different infections that can affect anyone who is sexually active. HIV stands for Human Immunodeficiency Virus. It attacks the body's immune system, making it harder to fight off infections. If left untreated, HIV can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. STIs are infections passed from one person to another through sexual contact. There are many types of STIs, including chlamydia, gonorrhea, syphilis, and herpes. Some STIs can be cured with antibiotics, while others are lifelong infections that can be managed with medication. Transmission. How do HIV and STIs spread? Understanding the ways in which HIV and other sexually transmitted infections, or STIs, spread is crucial for prevention and protection. These infections can have serious health consequences if not properly managed. HIV is primarily transmitted through bodily fluids like blood, semen, vaginal fluids, and breast milk. These fluids can carry the virus from one person to another, leading to infection. It's important to note that casual contact, such as hugging or sharing utensils, does not spread HIV. This can happen through unprotected sex, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. Unprotected sex, whether vaginal, anal, or oral, poses a significant risk for transmission. Sharing needles or syringes often associated with drug use is another high-risk activity. Additionally, an HIV-positive mother can pass the virus to her baby during pregnancy, childbirth, or through breastfeeding. STIs spread through various forms of sexual contact, including vaginal, anal, and oral sex. Each type of sexual activity carries its own risks, and using protection such as condoms can significantly reduce the likelihood of transmission. It's also important to communicate with your partner about sexual health and history. Some STIs, like herpes, can also spread through skin-to-skin contact. This means that even without sexual intercourse, close physical contact with an infected area can result in transmission. Herpes sores are highly contagious, and it's crucial to avoid contact with them during an outbreak. It's important to remember that not all STIs cause visible symptoms. Many people may be unaware they are infected because they do not exhibit any signs. Regular testing and open communication with healthcare providers are essential for early detection and treatment. It's crucial to practice safe sex by using condoms consistently and correctly. Condoms are highly effective in reducing the risk of HIV and other STIs when used properly. They act as a barrier, preventing the exchange of bodily fluids that can carry infections. Regular testing for HIV and STIs is essential, especially if you have multiple partners or engage in high-risk behaviors. Early detection through testing allows for timely treatment and reduces the risk of spreading the infection to others. Remember, taking proactive steps in your sexual health can protect you and your partners. Recognizing the signs and symptoms of HIV and STIs. Many people with HIV experience flu-like symptoms within a few weeks of infection. These early symptoms are often referred to as acute retroviral syndrome, ARS, or primary HIV infection. They can be easily mistaken for common viral illnesses, which is why awareness is crucial. These symptoms can include fever, which is one of the most common signs. The body's immune response to the virus can cause a significant rise in temperature. Other symptoms include headache, sore throat, and fatigue. Fatigue can be particularly debilitating, making it hard to carry out daily activities. However, some people may not have any noticeable symptoms for years. This asymptomatic period can last a decade or more, during which the virus continues to damage the immune system. STIs can cause a range of symptoms, depending on the infection. Each STI has its own set of signs, and some can be more severe than others. Some common signs include unusual discharge, which can vary in color, consistency, and odor. This is often one of the first noticeable symptoms. Pain or burning during urination is another common symptom. This can be a sign of inflammation or infection in the urinary tract. Sores or bumps in the genital area and pain during sex are also significant indicators. These symptoms can cause considerable discomfort and should not be ignored. It's essential to seek medical attention if you notice any unusual symptoms. Early diagnosis and treatment can prevent complications and improve outcomes. Remember, not all STIs cause symptoms. Some infections can be silent, meaning they show no signs but can still cause long-term health issues. Regular testing is crucial for early detection and treatment, even if you feel fine. Routine screenings can help catch infections early, ensuring timely and effective treatment. Always consult with a healthcare provider about the best testing schedule for you. Section 5. Protecting yourself. Prevention methods for HIV and STIs. The most effective way to prevent HIV is to avoid contact with infected bodily fluids. This includes practicing safe sex, using sterile needles, and getting tested regularly. Medications like PrEP, which stands for pre-exposure prophylaxis, can significantly reduce the risk of HIV infection. Preventing STIs involves practicing safe sex, getting tested regularly, and getting vaccinated against certain STIs like HPV. Open communication with your partner about sexual history and testing is crucial. Remember, abstinence or limiting sexual partners can also reduce your risk of infection. Section 6. Debunking myths, addressing misconceptions about HIV and STIs. There are many myths and misconceptions surrounding HIV and STIs. It's important to separate fact from fiction. HIV cannot be transmitted through casual contact like hugging, sharing utensils, or mosquito bites. Another common myth is that STIs only affect certain groups of people. Anyone who is sexually active can contract an STI, regardless of their age, gender, sexual orientation, or background. It's crucial to rely on credible sources of information such as healthcare professionals and reputable organizations like the CDC for accurate information. Section 7. The importance of testing, early detection and management. Regular testing for HIV and STIs is crucial for early detection and treatment. Early diagnosis allows for timely medical intervention, which can improve health outcomes and prevent the spread of infection. Testing is simple and confidential. You can get tested at your doctor's office, a local health clinic, or even order at-home testing kits. Knowing your status empowers you to make informed decisions about your sexual health. Remember, early detection is key to effective management and preventing long-term health complications. Section 8. Treatment options. Living with HIV and managing STIs. While there is no cure for HIV, medications called antiretrovirals or ARVs can effectively manage the virus and prevent it from progressing to AIDS. With proper treatment, people with HIV can live long and healthy lives. Treatment for STIs varies depending on the infection. Some STIs can be cured with antibiotics, while others require ongoing management with medication. Early treatment is essential to prevent complications and reduce the risk of transmission. It's important to follow your healthcare provider's instructions and complete the full course of treatment as prescribed. Section 9. Your sexual health matters. Take control, stay informed. Your sexual health is an integral part of your overall well-being. By understanding HIV and STIs, practicing safe sex, Getting tested regularly and seeking timely medical attention, you can take control of your sexual health and make informed decisions. Remember, knowledge is power. Stay informed, have open and honest conversations with your partner, and prioritize your sexual health. Your health and well-being are worth it.